My name is Amanda Espinoza. This is the video presentation for my internship, Health 684, at Texas A&M University. I was an intern for Dr. Jackie Meeks at Cook Children's Healthcare System's Center for Children's Health, located in Fort Worth, Texas. Dr. Meeks is the Director of Community Health Research, and I work directly under her with two interns. The two interns were assigned to different projects, so I worked alone with the supervision of Dr. Meeks. I completed a literature review which answered the following research questions. What is the prevalence of low literacy of parents or guardians in the United States? What literature or information is presented to adults and their children specifically related to asthma? Is their material conflicting or confusing? Is the use of the literature impacting status of the children? My primary resources were the databases available through the Schwartz Medical Library at Cook Children's and the Texas A&M University Library. For this project, I reviewed the literature related to the parent and child health literacy related to asthma. The research questions, as stated above, move from the broad to the specific conditions and also assess the impact of literature on health status. All the articles had a valid measure of parental health literacy related to the health issue and were tied to an intervention. The specific projects of the internship for Cook Children's were a completed literature review and an asthma and health literacy matrix. 18 articles were produced from an original search using search terms health literacy and asthma, parent-child and health literacy, and health literacy and parent-child relations. The search was done in the Cook Children's Hospital library using PubMed. The 18 articles were reviewed for their fit with the selection criteria, which included U.S. study, research article, published within the last 5 years, included a literacy tool, and asthma. 9 articles were selected for further review and are listed in the matrix provided to Dr. Shipley for the final internship project. 10 articles produced from an original search using search terms health literacy and research. The search was done in the Cook Children's Hospital library using PubMed. The 10 articles were reviewed for their fit with the selection criteria, which included health literacy tool, research article, and published within the last 5 years. 4 articles were selected for further review and are listed in the matrix provided to Dr. Shipley for the final internship project. Products for proof of completion for the university included weekly journal submissions, a asthma and health literacy matrix, and a video presentation to Dr. Shipley. The CHES responsibilities and competencies that I addressed during the internship were: Area of Responsibility 1, assess needs, assets, and capacity for health education. Competency 1.1, plan assessment process. Competency 1.2, access existing information and data related to health. Competency 1.3, collect quantitative and/or qualitative data related to health. Competency 1.4, examine relationships among behavioral, environmental, and genetic factors that enhance or compromise health. Competency 1.5, examine factors that influence the learning process. Competency 1.6, examine factors that enhance or compromise the process of health education. Competency 1.7, infer needs for health education based on assessment findings. Area of Responsibility 2, plan health education. Competency 2.1, involve priority populations and other stakeholders in the planning process. I really enjoyed the experience of working at the hospital with other researchers. It was a great opportunity to see various options for future employment. I learned about many different aspects involved with interning for a hospital like Cook Children's. It was interesting to see research done in a real-world setting. It opened my eyes to many different research positions there are for students after graduation. There are a few expenses that the intern has to incur, like updating vaccinations, background, and drug screen that cost me several $100s. I think it would be helpful for future students to be aware of the cost before they begin the process. I learned that if the internship site requests a signed contract before the student begins, even if the internship supervisor feels it is okay to begin without the signed contract, it is necessary to wait until all documents are signed and approved before beginning. Since I did not have an approved contract, I did not have complete access to the computer systems, which made doing research a bit more difficult. It was challenging having permission from my internship supervisor to begin, but not having official permission from the Human Resource Department at the hospital. Those two departments were not on the same page, so it made it difficult to know whose direction I should follow. I would recommend to future students to find out if all documentation between Texas A&M and the internship site have been completed before beginning any work. I would follow the advice of the instructor for the course on which direction to follow if there are conflicting views. I would encourage future interns to find out if there are personal costs associated with the internship program. With that being said, I would recommend working with Cook Children's Hospital if the opportunity arises. It is a great organization to work with and lots of opportunity to learn and grow.